Welcome to The Explainer. All right, today we are putting on our detective hats. We're going to solve a medical mystery. How do you find a disease like pulmonary emphysema, a condition that's hidden deep inside the body? Well, it turns out you start by learning to decode the clues our bodies give off, clues you can both hear and see. So think about this. What does a lung disease actually sound like? It's a great question, right? Because when you're trying to figure out what's wrong deep inside someone's lungs, you don't always start with a high-tech scan. Nope, you start with sound. Or, as we're about to find out, sometimes it's the lack of sound that's the biggest clue of all.
Okay, so before we get into the clues, what's the actual problem we're looking for? At its core, it's pretty simple, but really critical. It's when the airways just can't move air the way they're supposed to. The technical term for this is airway conductance failure. And you'll see, every single clue we uncover is going to point right back to this one central issue.
So where does our investigation kick off? Well, we start with maybe the oldest diagnostic tool in the book. Just listening. Seriously, the very first clues, and honestly some of the most important ones, are all about what you can hear. And there's a fancy medical term for this, of course. It's called auscultation. You know, when a doctor puts that stethoscope on your chest, they're not just listening for your heartbeat. They're actually tuning in to the story that your lungs are telling, a story that gets told with every single breath you take. All right, and here's where our detective story takes its first interesting turn. Because you'd think the biggest clue would be some kind of weird gurgling noise, right? But nope, it's actually the opposite. It's silence. A kind of suspicious quiet where you expect to hear the normal, gentle sounds of air moving. And doctors are listening for two specific kinds of this quietness. First, there's what's called vesicular respiration. That's just the sound of air moving through all the tiny little airways. If that sound is super faint, that's a big red flag. And second, they'll actually have the patient talk, and they listen to the sound of their voice through the chest wall. Normally, it's pretty clear, but with emphysema, it sounds all muffled and far away, almost like the sound itself can't get out. Both of these clues are telling the doctor the exact same thing. The air just isn't moving like it should. But, it's not always about silence. The plot can thicken a bit. Sometimes, especially if another condition is involved, that quiet is suddenly broken by some very specific extra sounds. So, for example, if the emphysema is happening alongside something like obstructive bronchitis, a doctor might suddenly hear these distinct crackling or even whistling sounds. They're called rowels. And what you're hearing there is literally the sound of air trying to force its way through airways that are all narrowed or even filled with a bit of fluid. Okay, so our medical detective has gathered all the clues they can hear. What's next? Well, now you've got to see if the visual evidence backs it all up. It's time to move from sound to sight, and that means it's time for an X-ray. And when they look at that X-ray, a very specific pattern starts to emerge. There are really four key things they're looking for. First, the lungs themselves just look a little too transparent. Second, the bottom edges of the lungs seem to be sitting lower in the chest than they should. Third, the diaphragm isn't moving as much as it's supposed to. And finally, that classic dome shape of the diaphragm, well, it starts to flatten out. But the big question is, why? Why do all these things happen? I mean, why would a lung, which is made of tissue, suddenly start looking see-through on an X-ray? It doesn't seem to make sense, right? Well, the answer is all about trapped air. I love this analogy. Imagine a healthy lung on an X-ray is like a dense forest. In emphysema, damaged air sacs trap air, making parts of that forest look much more open and clear. So what happens is the tiny air sacs in the lungs get damaged, and they can't push air out properly. And that trapped air is way less dense than lung tissue, so it shows up darker on an X-ray. It's what creates those see-through spots, and it's a huge visual clue for doctors. And this trapped air creates a kind of domino effect. Think about it. All that extra air causes the lungs to overinflate, right? And where do they expand? Downward. They literally start pushing down on the diaphragm. All that pressure is what forces the diaphragm lower in the chest and flattens out its nice, normal dome shape. And of course, that's exactly why it can't move properly anymore. So let's step back for a second. We've got clues from listening to the chest. We've got evidence from looking at an X-ray. When you put it all together, what's the verdict? What does all of this evidence actually point to? Well, it turns out that the quiet breathing, the muffled voice, those transparent spots on the X-ray, they aren't just a random collection of symptoms. They're all pieces of the exact same puzzle, and that puzzle has a name: the syndrome of bronchial or airway conductance failure.
It's all pointing to that one core problem.
All right, so let's put it all together. Let's look at the complete case file now, just like a real detective would. We're going to lay out every piece of evidence we've found so we can see the whole diagnostic picture crystal clear. And here it is, the whole shebang. You can see how everything lines up perfectly. The auditory clues, what the doctor hears through the stethoscope, and the visual evidence from the X-ray, they tell the exact same story. They reinforce each other. And it's that powerful combination of evidence that lets a doctor say, okay, I know what's going on here. When you really think about it, this whole process is just an amazing story about using basic physics, sound and light, to read the body's secret signals. It really goes to show you that sometimes the most powerful tools in medicine aren't the most complicated machines. It's just our ability to listen really carefully and to look a little closer. Makes you wonder, doesn't it? If we can uncover all this with just sound and light, what other mysteries are waiting inside the